going to explain what Roberta needs to get done and how the surgery was performed on her previously.
Okay, so what we basically have is on that left side, there was a chronic fractured femur. Everything else apparently looked okay. The way that it was fixed, 2 bone plates were placed and the limb was shortened. Based on this, what we're seeing now is that the kneecap, which previously was in its normal anatomic alignment, now luxates and wobbles around.
Mean keeps popping out.
Right, and that could occur basically because if what we're seeing is from everything being shortened, the muscles are long and so it's loose. Mm-hmm. The problem, unfortunately, is that regardless of why that is now an issue, it's an issue because it's going to make it more difficult for her to go ahead and to bear weight appropriately.
On that leg, yeah.
On that leg. The question is, do you go in surgically to stabilize it? Because this was just done so recently, by no means is it a life-threatening emergency to have to go back in on her.
Mm-hmm. On the leg that
was
surgery,
just operated.
yeah.
And so I would give her the opportunity for that to heal in
on its own,
and then you can come back and potentially do something about the kneecap once we know she's that much further down the road, stable, solid, and everything else.
As far as the right leg?
Correct. With regards to the right leg, everything looks fine except she has what we call a grade 4 out of 4, which is the worst type, patellar luxation or dislocation. What happens is for a grade 1, it's in most of the time. If it snaps out, it goes right back. A grade 2, it's in most of the time. It pops out, it can stay out a little bit, but then it goes back. A grade 3 is the break point. It's out most of the time. You can get it to go in, but it's going to come right out. And a grade 4, it's out, and no matter what you do, you can't get it to go back in.
It's kind of permanently out without. Okay.
So the question for her is, did she always have a patellar luxation tendency, because it's not uncommon in small breeds of dogs? Or was this exacerbated by the trauma that she had? And is there a lot of underlying trauma down there where the kneecap was knocked out and now it's bound down in a lot of scar tissue? Mm-hmm. The difficulty with these guys, with the grade 4 out of 4 patellar luxations, is that it can be difficult to get them to get back to exactly where they're supposed to be. Technically, when you're in there, you see what the groove is like for the kneecap to be held in place. Mm-hmm. If it's going to be very shallow, you make a new groove to put it into. But if this thing is so bound down over here, when you try to pull it back, these tissues are so tight, you're going to have to cut through them. And then these could get that loose, you got to tighten them up. Mm-hmm. On some of them, the insertion point, so you have your quadriceps, your patella tendon. If this insertion area has shifted this far over, you have to cut that off or shift it to pull it back to get everything to line up.
Aligned, yeah.
And so those are more difficult, especially when you get dogs that have horrible grade 4 out of 4 luxation tendencies. The issue is that without surgery, I mean, she's never going to die. She's just going to be that gimpy. With surgery, it's whether or not you could get her back together again to really walk much better. The concern is she's always going to have some significant mechanical lameness because of the trauma and because based on the way this chronically fractured leg was fixed, a lot of length was lost as opposed to trying to regain all of that length. Because technically what you would like to do when you break them is you stretch it out to as long as it's supposed to be and you put a bone graft in there. And that way you have that much of a longer limb to go ahead.
Because right now, oops,
Yeah,
sorry.
no, that's fine. To get them, you know,
Right
back
now,
together.
this also throws her spine out of
Right.
whack.
And so that's where,
Roberta.
you know, the question really comes down to.
Thanks for the gift.
Oh, no problem. But that's where it really comes down to.
Oh, there's more?
Yeah, that's
Jeez.
fine. Is how aggressive do we end up getting surgically, understanding that no matter what you do, she's always going to be off.
See, I don't expect her to be perfect at all. And as long as we can get some sort of a betterment on the leg that needs the surgery, I mean,
Right.
I would settle for a
Right.
percentage.
The concern with that is, in some cases, you could go ahead to do everything correctly and perfectly, and they're worse.
Mm-hmm.
Because if it is that difficult to get it to stay into place, or she was really beat up that badly with some of her tendons and ligament detachments, even if you go ahead and get everything back to where it's supposed to be, she may be stiff in there and not be able to bend it as much. So you may end up with restricted range of motion. Based on where she's at now though, I agree. She's putting way more weight on her left leg, and her right leg she really prefers to carry. So I can totally understand going ahead and trying to do something for that right leg and get that kneecap back where it's supposed to, understanding a guarded prognosis for making her, you know, really great.
Yeah.
The other thing is that before I would do that, it's the same thing. If she's only like 17 to 20 days down the road from her one side, I would not rush in to doing that one, because there's no way she has full healing on this leg. And the last thing I want to do is go in here, take another leg out from underneath her while she's absolutely still technically healing from this. And so because it's not a life-threatening emergency and this has been a chronic change, you have the ability to wait and have some time before you're going to go ahead and attempt doing this. You want to make sure that this thing is not going to have complications, is not going to fall apart before you start screwing with this other side.
How long would you think the wait should be?
Usually, I would give her 6 to 8 weeks. Re-x-ray her and make sure that you're seeing phenomenally excellent healing here, and that you're not going to see some of the screws moving or some wobbliness.
Oh, okay. And would you suggest physical therapy? Because they didn't tell me anything about that.
You certainly can. I mean, it can't hurt. They just have to be really, really gentle, you know.
So
with
mobilization,
the therapy.
what would it be? What would you recommend? And
Well,
if you
there's
know
a
the
couple of
place.
places that do physical therapy here that I could refer you to,
I would
because
love
they
that.
do so much. But it's probably combinations of just the manipulations and stuff. There's laser, there's acupuncture. A lot of them use like underwater treadmill therapy, but that's assuming she's going to feel comfortable
With the water.
swimming. She doesn't like that. She gets so freaked out. I don't want her to drown, because both of her back legs are compromised.
Right.
So, but if they can work things where, especially on the right leg, you might be able to get more flexion and extension and break down some of these adhesions, it may eventually make it easier surgically to get things back to where they're supposed to be.
Okay. All right.
So that's pretty much where we would be.